study, correct? We stopped with the video. So today, we're gonna further talk about different procedures of the colon. We're gonna talk about colonography and go into depth about barium enema procedures. I do have to wrap up by 11:10. Since Clayton wants to address the class, so let me try to be quick. So, CT colonography is also known as virtual colonoscopy, virtual CT. For this exam, we don't need a scope like we do with a colonoscopy. The patient does get a rectal tip inserted through which contrast is pushed through. Usually omnipaque. If you're talking about CT, it's not going to be barium, it's going to be omnipaque mixed with water. This is less uncomfortable for the patient because
it's less invasive.
Less invasive. We're not putting the whole scope through the entire colon, right? It's just a rectal tip. And also, omnipaque is not as thick and pasty like barium is, so it's less likely to have accidents on the table.
Accidents being like leakage and whatnot?
Leakage, barium exploding all over, like I'm sure Mr. Donahue told y'all his story.
Yeah.
Have you had anything like that happen?
Never, thank God. Knock on wood.
What did you say? What did you say?
So CT, what was your question, Charlie?
Yeah, what did you say? You said, it is done with contrast, using a rectal tip, but you said it was done with something. I didn't hear what you said.
Contrast called omnipaque. You don't need to know
Okay.
that, that's just side note. So since this is CT, we're not gonna use barium, okay? So, the CT scan takes 3D images that allow the radiologist to see inside the colon, almost as if it's a real colonoscopy, but it's less invasive. And you are able to visualize the entire colon, the entire length of the colon, and it simulates the views of a conventional colonoscopy. So what's the advantage of this procedure? It only takes about 5 minutes. Very minimally invasive and less discomfort to the patient. Okay?
Because it's just a tip.
Just a tip.
I thought this machine was like
I'm sorry?
I thought this machine was like an MRI. Well, it looks like an MRI.
It looks similar to an MRI, yes, but MRI does not have radiation. CT has high dose of radiation. So like I said, this procedure does not involve the use of a scope, does not need sedation or recovery time. It's very quick, 5 minutes. And it's also used as a screening tool for early detection of cancer, polyps in the rectum or colon. Okay. Moving on. Now we have what is called a sigmoidoscopy. What's the difference between a colonoscopy and a sigmoidoscopy? Says it right there on the screen. Sigmoidoscopy examines only the lower third of the colon, not the entire colon. Okay? That's simple enough.
Why does the texture change of the sigmoid?
I'm sorry?
Why does the texture, like the wall linings, I guess? It seems like there's somewhat consistent pattern, like for most of the large intestine until it hits that last bit.
That I am not sure.
Okay.
Do some research and let me know. Just a side note, the sensitivity for colonoscopy in detecting cancer and precancerous lesions is greater than 95%. So the doctors love colonoscopies.
Yep.
You said it's
I
nice.
said the sensitivity for colonoscopy to detect cancer is 95, or is greater than 95%.
So they have less than 5% of like missing it?
Correct.
I usually haven't seen it.
Colonoscopy?
No, like colon cancer is usually more men than females.
I'm not sure if it's more on men, but I do know that both males and females can get it.
Then is it the prostate that is exclusive to men?
Prostate cancer, yes.
Okay.
All right, now we're going to talk about barium enema. performed by a radiologist or a radiologist assistant. Of course, we know that barium is inserted through a tip in the rectum and it fills the entire colon in a retrograde fashion. Why is it in a retrograde fashion?
To see where the obstructions are. If you're
So
going bottom
retrograde
up.
meaning backwards, right?
Yeah.
It's flowing backwards into the colon.
Right.
So the barium bag would be hung up about 30 inches from the table and it would flow in a retrograde to the colon. So why is a barium enema performed? If they suspect that your bowel, or if they suspect any polyps, lesions, etc., they would want to do a barium enema. If you have any sort of inflammations in your colon, or something has changed in your bowel movements, they would want to do a barium enema. Now, not all patients can get the barium enema. If they suspect that your bowel has any sort of perforations, they would use a different type of contrast that's water soluble. The name is gastrografin. This is important.
Could you spell that?
GASTROGRAFIN. And why is a water soluble contrast important? Because if your bowel is perforated, you would want the substance to dissolve easily, right? Barium does not dissolve easily, it coats, it's very thick and pasty. You would not want barium leaking in your peritoneal cavity. That's very toxic, and you would require surgery if that happens. So what's the name of the contrast that's water soluble?
Gastrographic.
And it's important because it's quickly reabsorbed through the peritoneal surface, so it's not as toxic to your body. That's just a picture of a perforated bowel. And we would not use barium on this patient.
Is that a
Like when you get like in your.
With an ulcer and an
inside.
yes.
Top,
Yeah, so if patients have any sort of ulcers or polyps or anything that damages the colon, that could cause a perforation. Yes.
Can you see that in the X-ray?
So, yes, good question. How would we be able to see if there's a perforated bowel?
Like a CT?
So, the colon has a hole in it, right? So what would come out?
Feces.
And
Blood.
blood?
Plus.
also air,
Okay.
right? And what position do we do to view air and fluid in the abdomen?
The cubitus.
Someone said it.
On the-
Decubitus, yes. So if you wanna see the air and air rise away from the stomach, what was it?
On that lateral.
Correct.
Bowel will not use the barium, you said, no?
I'm sorry?
In the perforated bowel.
Yes, you would not wanna use the barium, cause it's toxic. You don't want barium floating around in your peritoneal cavity. Yes.
So we're gonna do the X-ray first and then the okay when they have the perforation, so we'll just not use barium?
They could be detected on x-rays, CTs, colonoscopies.
Oh, okay.
So if they have prior knowledge that this patient has a perforation, they're gonna put in the comments, do not use barium.
Okay.
So this is an example of the prep that a patient would have to do if they had a barium enema scheduled. Most hospitals use a 48-hour prep. It's a lot of drinking liquids and taking enemas to make sure your colon is completely clean before that enema. Okay, the radiologist does not want any accidents involving feces. So 48 hours before, they're instructed to eat light meals, and then afterwards it's all clear liquids. Some patients also drink milk of magnesia, which is like it helps you poop. And they also make you take laxatives,
Yeah.
pills.
Magnesium.
Like,
So the patients that come in for these barium enemas, they are spotlessly clean.
That's not true.
If they paid attention to the instructions. So the patients would be instructed to have a low residue diet. So they would avoid fruits, veggies,
Taco Bell.
Taco Bell, yes.
Yeah,
Only
Taco
clear
Bell.
liquids, fruits,
Yeah, it would do the same.
raw,
low residue diet, low fiber diet, right?
yes. Gelatin. They would use laxatives like castor oil, milk of magnesia.
Mineral oil. Mineral oil is a laxative as well.
Oh, did not know that. And then of course the patient would have to drink lots and lots of water and fluids to be well hydrated. This is an example of a liquid laxative. It's a saline solution, comes with a little tip for insertion. And if the doctor tells you to do a liquid laxative, this is something the patient would use. So, went too fast. So, for barium enemas or any other procedures, it's important to differentiate patient prep versus bowel prep. What do I mean by that? Sometimes techs get so in the habit of repeating these instructions over and over that they forget that the patient needs to understand the preparation. So what's one way you can make sure your patient understands what to do?
Explain, give them a paper,
Asking questions.
ask questions.
Exactly. Ask them to repeat back to you what you just told them. Because you can tell them like, okay, so you have a barium enema next month, you need to do this, this, and this. The patient may not remember what to do. So one way to make sure that they understand is have them repeat it back to you.
I think the Maloma, she got when they called her like a week before and like you
Reminded them again.
Yeah.
Yeah.
What to do.
Because patients are not gonna remember. This is a X-ray image of a patient that has barium in their colon. As you can see, everything is nicely coated, so it's very easy for the radiologist to see different parts of the colon.
This was done through that retrograde thing that we talked
Correct,
about.
barium enema. What's the star of the show here for barium enemas?
Sigmoid.
The entire colon. Only the large intestine, not the small intestine. So, barium, why does it show up so white on an X-ray? Because it has a high atomic number. So it shows up very bright and white. And it can be pre-mixed, already pre-mixed, or it can come in a powder form. And radiologists like it because it's very thick and pasty, and it coats the colon completely. And it provides adequate density on an X-ray. The barium is very radiodense.
And this is specifically for barium enemas as opposed to the exams that they like modified.
Barium swallow?
Yeah.
Yes,
Okay.
because barium shows up super white,
Mhm.
so it helps them see things very clearly. Okay, so we have single contrast studies and double contrast studies. Simply put, single contrast would use one type of contrast, probably just barium. Double contrast would use both barium and air. And you can see that the tubing is different. This tip right here has a little balloon attached that can be inflated inside the patient. And then we have this little balloon outside that helps the tech insert air if the radiologist requests it.
Is that the balloon that popped on this one?
I think so, yes.
Yeah, how do you know when to stop pumping it?
Stop.
Pumping the balloon?
It's usually 2 squeeze, and you would just clamp it so the balloon does not deflate.
Yeah, you also you'll put I forget what it's called, but you can measure it. It's when I was doing it, it was like 10 milliliters of air.
Mhm.
Do you have I don't know, it's not a syringe, it's just like something that you put,
A gauge.
like a It looks like a shot. It's not a shot though. It's just like something that you can put liquid in and just like.
Oh, like a
squeeze.
clear syringe?
Yeah.
Okay.
Yeah, and then we just put it on there and you just press it. You pull it out to 10, and then you
Mhm.
just press it down, and then you
The
because you have to
balloon's
check the balloon before you insert because
Oh, yes,
if you
good
don't,
point.
you know,
Good point.
that's not good.
Yeah, so always make sure your balloon is functioning properly before it's inserted into the patient. That way you know for a fact that it works and you won't have any accidents.
So you would do like a test inflate?
Test inflation,
Yeah, you
yes.
just inflate it and then de-inflate it.
Okay.
So, would this be similar to, like, when they're trying to induce sleep, when they put the balloon in?
Yeah,
Is that similar to this? I know it goes in a different spot.
It's like the Foley
but
catheter.
is-
I have no idea
Yeah.
about labor, I have no kids. I don't know.
I thought it was a balloon thing.
Oh, I ain't getting nothing.
Yeah,
Oh, so
like
the
to
baby
help
won't
you
come out?
Yeah, to help you dilate, and they pump it,
Mhm.
and it's supposed to help you get, and once you get to
Cervix
a
dilation?
certain, yeah, once you get to a certain point, it like just falls out.
Hmm.
They also put one whenever it's not time
Y'all
for you
get
to
that?
deliver the baby, and they put one like you're
Like
like
to stop it.
to stop
Mhm.
dilation.
Maybe it's just to help the cervix dilate, I'm not sure.
Maybe it's that something though.
So you see, this one does not have any sort of balloon attachments, it's just a tip connected to a long plastic tubing. This is primarily what we use in CT for exams that would require contrast. So we would fill this bag with a little bit of contrast mixed with water, and then the tip would be lubricated, and then nothing else involved. This is specifically for barium enema. This tip has a little balloon attached here. This is what you would squeeze to inflate the balloon. And then this is to administer more air for the study that radiology requires.
So there's two pumps then?
Correct. So these are the different parts of an enema kit. We have our enema tip here. And then this whole thing is a tube through which the barium will flow. We have our enema bag that holds the barium. And then we have the little pump that inflates the balloon that's attached here. Okay? So, this is very important, Cody brought it up earlier, the most common complication of a barium enema is damage to the rectal wall from improper use of balloon catheter. So it's important to remember to deflate the balloon before you pull out the tip, please. You remember that the tip is, after the tip is inserted, the cuff is inflated to hold the catheter in place, but when you take it out, please remember to deflate the balloon.
Would we have to
Can you
know,
go back?
Mhm.
Thank you.
would we have to know the, milliliters of air?
I'll send y'all the proper answer today.
Thank you.
So the most important, thing to remember with enema is communication. Don't just tell the patient, alright, get on your left side and boom, surprise, rectal tip. Please don't do that. So obviously when the patient comes to the department, make sure you tell them step by step as to what is going to happen. Even when they're ready and on the table, you make sure you tell them, alright, now I'm going to lubricate the tip. This is what's gonna happen, don't just surprise them. So what position is the patient in?
Sims.
Since, correct. So they're on their left side with their right leg in the front, and you can see that their left leg is back closer towards you. This makes it easier for the tip insertion. Less uncomfortable for the patient, it's easier for us to find where we need to go. And then of course, the enema bag is going to be hung upside down.
What position is this one? How do you spell it?
Sims, as I
Sims.
said.
Why does she have her shoe covered?
That's a great question, I have no idea.
Just to be more.
To get dirty.
Just to be like.
Maybe they just put shoe covers on her shoe.
Yeah, when people get their
She
feet
doesn't have
dirty.
to.
You said the back will be hung upside down?
Bag will be hung upside down. So in CT, whenever we would do rectal tips, we would just mix the contrast with some water. We wouldn't use barium like I said. And it's important to release the air from the plastic tubing. Why is that important?
So it,
Good, so it doesn't inflate and.
So it won't.
Are you
They're
talking about?
going-
Yeah,
like
so
a-
you don't unnecessarily inject air into the patient and
Yeah.
have them feeling all uncomfortable. So what we would do is fill the bag with our contrast and water and just release a little bit through the tubing. So we would get rid of any excess air that was hanging out in the tube. And my male coworkers were notorious for not wanting to do rectal tips, so they would purposely say, oh, the patient requested a female tech. And sometimes if they had to end up doing it, they would close their eyes and try to feel their way around. And the patient was like, I don't know what that guy was doing, but that was not fun for me. Like, you would think they would be less embarrassed being a tech, but nope. Alright, enema tip insertion. Lucky for you guys, barium enemas are not mandatory. Y'all got lucky.
Oh.
It was mandatory for you?
Yes.
So we
I
don't,
just had my tech do the whole thing and she just signed off.
so we don't have to come?
No, it's an elective.
Oh, okay, cool, awesome, great.
So, on expiration, the enema tip would be inserted towards the belly button, about 1 to 1.5 inches. And then once it's slightly in, we would direct it superiorly. It's not really rocket science, you just insert it, okay? I don't know why they gave us specific steps.
What do you mean by on expiration?
When the patient does expiration,
When they realize.
It's breathing.
breathing out. So they're relaxed. And then it should not exceed more than 4 inches. The entire thing does not need to be in the rectum, just 4 inches. So this is what it would look like. The bag is hanging upside down, holding the barium, and we have our plastic tubing that's gonna release it into the rectum. While the patient's waiting for the radiologist, obviously make sure this bag is clamped, right? You don't wanna get rid of the barium that's needed for the study. And the bag is suspended at about 24 to 30 inches. This is what your textbook says.
is that bag clamped in the picture or no?
It looks like it's clamped, yeah.
Cause I see the fluid down there and then like a period where it looks kind of clearish and then,
Yeah, they might have released some fluid and then clamped it.
okay. But the air that is in between wouldn't cause the patient any discomfort or is that just like a little vacuum?
The air is released prior to the start of the exam.
Okay.
Or what was your question?
I'm just confused as to whether or not the clear section of that tube is air or if it's just like a
Right
vacuum.
here?
Yeah.
No, it's white.
That's white, the whole thing's white?
Yeah.
Okay. I guess it's the white.
So on the test, is it gonna be like 24? You said the textbook says 24?
Yeah, just know that it's 24.
Okay.
So what position is this right here on the left side?
The cubes.
Anyone?
Oh,
Left
because
lateral
it's
to
big,
cubes.
so.
What position is the patient in?
Left.
The left cubes.
Jay, what is it?
The left cubes.
It's a left lateral decubus. How do we know that?
Because of the line of the.
So you see the air and the fluid, right?
Yes.
So the air has risen to the top and the barium has fallen to the bottom. And what body part is this that we're looking at?
Colon.
The colon, exactly.
why is their transverse colon so far down?
Yeah.
And are they
Maybe it's
extended?
maybe
They look
Oh,
very
wow.
they look very small.
Possibly. They
Yeah,
might be
I
a
think,
very small
I think they're
patient.
extended.
Oh,
Yeah,
good
because
stuff.
they're
Yeah.
no, but like look at where their pelvis is, their like lungs and chest. That's a very tiny patient.
Yep.
Would that be a small person?
Or maybe it's because of the position that they're in.
Oh.
They're in a left lateral, so maybe everything is kind of like.
So is the first picture a single?
This is a double
double?
contrast because we have air and barium.
Okay,
This is just simply barium, so single contrast.
okay.
Okay. Alright. So, double contrast barium enema is primarily used to detect polyps. We have two types of contrast, barium, which is positive, that's why it shows up white and bright, and air, negative, shows up dark or black.
What do you mean barium positive and air negative?
Positive contrast, negative contrast.
Did you do that?
Yes.
YouTube, love, you can't.
So barium would be white and air would be black.
Correct. Air is negative, so it shows up black. Barium is positive, so it shows up bright.
Ulcerative colitis, so I'm taking Zeposia on once daily pill.
Colon wall called diverticula, ulcers, or narrowed areas known as strictures. If you develop unexplained bleeding, abdominal pain, or change in your bowel habits, your doctor may recommend you get a barium enema examination. Before the procedure, you'll be asked to lie down on an x-ray table. A lubricated tube will be carefully inserted into your rectum. A bag containing barium will be attached to the tube, and the barium will be allowed to flow into your colon. When enough barium has flowed into your colon, you'll be asked to try very hard not to expel any of it while x-rays are taken. A tiny balloon attached to the tubing that carries the barium may be inflated to prevent any barium from leaking out during the exam. While the x-ray pictures are being taken, you'll be asked to roll from side to side or to stand up. This lets the barium flow to different areas so that sufficient x-ray images can be obtained of your entire colon. After many x-ray pictures are taken, you'll be given a bedpan or taken to a bathroom and asked to expel as much of the barium as possible. A few more x-rays may be taken after you have passed most of the barium out of your colon, because the small remaining amount of barium clearly illuminates the outline of your colon. After your barium enema, you can go home. You will most likely be able to resume your normal diet. Most radiologists instruct patients to increase their fluid intake for a period of time to be certain all of the barium is passed. You will likely notice more gas than usual and see barium in the next several bowel movements that you pass.
Across the whole planet, humans eat on average between 1 and 2.7 kilograms of food a day. That's over 365 kilograms a year per person.
Thank you for that.
In other words, we be shitting. What's that?
So after the barium enema is completed, important to note, the cuff must be deflated before the catheter is removed. And of course, you wanna make sure the patient is given post-examination instructions. So make sure you tell them to drink plenty of water so that they can poop everything out. And also, it's important to let them know that their poop might be a weird gray color because of the barium.
Are there any possible side effects or complications to barium just hanging out and staying there for a while, or?
You don't wanna hang out for a while, cause you might get constipated, which might lead to other problems, that's why it's important to let them know to
Try and
get
flush
rid
it
of
out?
that, yes. Alright, almost to the end. So, what is a colostomy? It's an opening in the belly or abdominal wall that's made during surgery. It's usually needed because the person has some sort of problems with their colon not functioning properly. So that makes them pull the colon out through the stomach and then attach to a pouch which collects the fecal matter. Okay? Yes, it's called a colostomy bag. And the end of the colon is brought through this opening in the skin to form what's called a stoma. Some patients might only have it for a short period of time. Some might have it for the rest of their life if they have serious conditions such as cancer that's causing their colon to not function properly. So if a barium enema is ordered for patients that have colostomy bags, it's going to be a little different. Obviously, they're not going to get the regular rectal tip. They would get cone-shaped tips to be inserted through the stoma. And also for these patients, the amount of barium that they use is going to be significantly smaller.
Do you
It
have all
probably
this
does hurt.
information in the book, ma'am?
Yes, all of this is in the book.
So there is a chance to recover the function of your colon?
Correct. If they do this procedure to let other parts of your colon heal with whatever is going on, they will do a barium enema to make sure that part has completely healed before they do the reconnection surgery. Okay? So yes, make sure you read these pages, 239, 240. And that's just what a stoma would look like without the dressing. If a patient were to show up for a procedure with a colostomy bag, usually they will know to bring an extra bag because they would need a clean bag after the procedure happens. Most of the time, these patients do know how to remove and change their own dressings, but we may just need to assist them. And that's an example of a type of tip that would be used for colostomy patients. Yes.
So they're instructed to do all the cleaning and stuff themselves, and
They're instructed to bring extra pouches with them to the procedure.
Yeah, like when I had a bunch of these come in, and they all had these pouches, and they were coming in because their intestine was severed,
Right.
and that's why they're having this. When some of them come in and it's already cleaned, and because they know most likely that it needs to be cleaned. And then some of them come in and, you know, we ask them, it's like, is it clean? Because we need it to be clean in order to do this. And they're like, no, but I have an extra. And they know how to change it, so there's literally a bathroom in the room. At least at LBJ, there's a bathroom in that room. But we just ask them to go change it. And they know how to do it themselves. And at least for that day, we didn't have to help anybody change it.
Okay.
So it just depends, you know, if they know what to do. But if they do change it though, like you're probably gonna have to wait like 20 minutes or so, because it takes them a little while to
Get it back situated.
at least put a new one on there. I mean, we asked them to either put a new one on there or to clean it out. That's just what Dahlia asked them to do. So, but for the most part, they would normally just put a new one on there. So.
You haven't had to deal with a patient who has rather unsanitary practices?
Just before.
No, they were, I mean, not personally, no. When I did those, no.
Did your tech say anything about that? Like they came in with a patient who's like partly necrotic or whatever?
I mean, there was somebody who came in that had a lot of their like intestine was out, and it was very prominent.
Yeah.
And you could like there was a picture earlier that looked just like it, and there you can see the hole that's there.
Yeah.
But even when they clean the bag, it's still with that one patient because it was protruding out a lot more. When the exam was done and we took out the tube, a lot of liquid did come out.
Right.
So we had to help them, you know, kind of keep the bag up so it didn't slip out.
Or like leak back onto them.
Right, or leak back onto
See,
them. Yeah.
that was my question.
Yeah,
Like,
yeah.
I don't-
Sometimes it'll happen and sometimes it doesn't.
Right.
You know.
like a accident or whatever, like they accidentally squeezed it, now they got backflow,
Yeah.
like that's one. So what kind of infection would that be, like sepsis or like how do they even clean that? Alcohol wipes or like what?
Well, so when she saw that it was coming out,
Yeah.
She actually went. There was a sort of like a plastic blue bag in there. It's just like a plastic blue bag, and it had like a plastic like circular rim on the top.
Yeah.
And she